I just want to welcome everybody here. This is going to be a really exciting day, I think, because we have 3 fantastic experts who are here to answer pretty much all of your questions about COVID-19 and vaccinations, and I know there are a ton of them. I'm not going to speak too much, as I already indicated, but I will introduce everybody off the top. Our 3 presenters today will offer sort of a very brief introductory presentation, followed by a lot of very hopefully not too confrontational or controversial, but a lot of questions about what we need to know about COVID-19 vaccinations and for all of the people who are listening. So without further ado, I would like to introduce Dr. Cor Constantinescu. She is practicing pediatric infectious diseases at the Alberta Children's Hospital in Calgary, and she loves all things vaccine. She sees vaccine hesitant patients in clinic and reviews immunization reaction cases as part of vaccine surveillance and doing research on vaccine safety and factors affecting vaccination hesitancy and behavior. So Dr. Constantinescu, please take it away, and we'd love to hear your thoughts.
Perfect. Thank you very much for having me. I'm going to share my screen, so bear with me here. I hope you're all seeing it. And I'm just going to do this a little bit. Here we go. So thank you very much for having me. And I tell you, it's a bit of an emotional day because this is the 1-year anniversary of WHO calling this a pandemic. And it's a National Observance Day for COVID-19. So it's a bit emotional and daunting and also kind of exciting to present to you today and also to show you the next slide. So I'm excited about this slide. So this is my favorite slide in the whole presentation because it shows that as of yesterday, we had over 2.5 million doses administered to Canadians of the COVID-19 vaccine. And the best part about this slide is that it's already significantly out of date because a lot more people have had a vaccine since then. We know that we have 4 authorized vaccines in Canada, 2 mRNA and 2 viral vector vaccines. You've probably heard quite a lot about how well these vaccines have done in the phase 3 clinical trials. I'm going to just briefly show you a few slides on how the vaccines are doing in what we call the real world, which means that even after the vaccine has been authorized and it's being used in the population, we can look and see at how well they're doing in terms of protecting against disease, infection, hospitalizations, as well as looking at safety, which is an ongoing monitoring system. I'm going to show you some data from the UK. So this is from a study called the SIREN study. This is done on healthcare workers, and they looked at a couple of things. They looked at after the 2 of the mRNA vaccines. They looked to see what the risk of infection was afterwards. So this is important because this is where people were talking about. It's not just about symptomatic COVID disease, but also just infection with the virus. So 1 dose of the vaccine seemed to decrease infection by 70%, up to 85% after the 2nd dose. With symptomatic COVID-19 disease, it also seemed to do really well with just 1 dose, and then even better after 2 doses for people under 65, but also people over 80, which is a constant concern in vaccines. It's something called immunosenescence. People worry that their health, the immune system may not respond just as well. So this is from the mRNA data in the UK. Then we also have mRNA vaccine data from Israel. So this is a large group. They actually matched the vaccinated and unvaccinated pairs. They had over around 1.2 million people and just under 600,000 being the ones that got vaccinated. And again, they showed the vaccine maintained effectiveness in people over the age of 70. And again, after the 1 dose or 2 doses, you can see pretty good effectiveness shown, especially around hospitalization, severe disease, and overall symptomatic illness, but also the asymptomatic infection, which is also very powerful.
So
You've heard a lot. Oh, yeah?
Go back on the previous slide. I just want to clarify that when they say 84% death, that's a reduction in the chance of death by 84%, right?
Correct. Thank you. Yes, good point. So reduction in death, severe disease, symptomatic illness, and asymptomatic infection. So we're looking at reduction in death, but thank you for catching that. That's a very, very powerful statement.
Yeah.
Similarly, we now have some real-world data coming out of Scotland and the UK around the AstraZeneca, which is one of the viral vector vaccines authorized in Canada as well, and one of the mRNA vaccines also authorized in Canada too. So this is now, we're looking at huge numbers of people, talking about millions, and they look to the effectiveness of preventing hospitalization after one dose of each vaccine. And what I want to bring to your attention is that one dose of the AstraZeneca vaccine, there was a 94% decrease or prevention of hospitalization, and after the Pfizer, the mRNA vaccine, 85%. So again, showing that all the authorized vaccines that we have are actually quite powerful at preventing hospitalization and severe disease. Now, the next few slides I'm going to talk about is I want you to turn into vaccine champions. So it's great to have you all here. You're probably quite involved and keen to learn about the vaccine, but you've also are probably people who for the last year have worked really hard at preventing this disease from happening for themselves and their families. So I want to bring up just a few things on what you can do to promote this vaccine to your friends and family, because you have great influence on the people around you. The first thing I want to tell you is that when people look at vaccines and when there are denials or concerns around the vaccine, it's not that people don't believe that facts are true, is that they just don't apply to them. So it's really important to think about how to talk about this vaccine within the context of each and every person. Issues with concerns around the vaccine are around many types of reasons. So most commonly, you might have heard issues around confidence. So people may not trust the vaccine is working or is safe. They may not trust health agencies or governments. People may not feel at risk of the disease. This is kind of a twofold problem. So sometimes people just don't believe that COVID-19 is a risk to them. But interestingly, we've also seen people who think that COVID-19 is a concern, but they feel so safe in their compliance with the recommendations that they think that they don't need the vaccine. So again, very interesting how people perceive the risk of the disease. Issues around convenience. So you've probably thought a lot about the scarcity of the vaccine, the rollout, issues about where people get their information from. So if you're a vaccine hesitant person, you're less likely to go to trusted sources of information like health agencies. And this issue of collective responsibility. So we're saying to people, we want everyone to take the vaccine, everyone who the vaccine is authorized for, so that we can actually protect everyone in the community, especially those vulnerable people. So I'm going to recommend to you that you try something called the PROTECT framework or the PROTECT plan. So this is a way to hold the vaccine discussion without necessarily being a vaccinology expert. So in ways that you can talk to your family and friends, even without knowing all the science there is to know about the vaccine, in a way where you can build trust and common ground. So PROTECT stands for the following. So the PR part says that it talks about proactively talking about it and making a presumptive statement. So I'll give you an example. You may say, have you heard that Canada is getting 1 million doses a week of the vaccine now? I am really excited to get my vaccine. When are you going to get yours? So instead of saying, are you going to get yours? You're going to say when. You're presuming they're going to go ahead and be vaccinated. Then you're going to offer to share your knowledge. So you can say, I've just gone to a webinar on this. There was a panel of people there. I've learned a few things. Can I tell you about them? Then you're going to tailor the recommendation to that specific person. So for example, if you're a 61-year-old person previously healthy and that's your friend, you can say to them, you're 61, you qualify for the AstraZeneca vaccine right now, and you have a pretty good quality of life. Less likely that you're going to die, but there's a risk of hospitalization from the disease. And then you're going to address that concern and you're going to say the AstraZeneca vaccine has been shown to be really good at preventing hospitalizations. Now, hospitalization is no small thing, so it's a big deal. And here you have a chance to prevent it. So try to tailor the recommendation to that specific health concern. And the last T, talking through a specific plan. So you can say, especially if you know things about the vaccine rollout, for example, in Alberta today, if you're born in 1958, you can actually go ahead and book your vaccine. So I'll stop here. Thank you for listening to my little bit of information. I'm happy to discuss this more in the question and answer portion as well.
Thank you so much for that. Really appreciate it. Next, I'd like to introduce Dr. Allison McGear. She is a professor in laboratory medicine and pathobiology at the Dalla Lana School of Public Health at the University of Toronto, as well as a senior clinician scientist at the Lunenfeld Tenenbaum Research Institute of the Sinai Health System in Toronto. Dr. McGear sort of is the go-to person for a lot of us reporters in Canada when it comes to speaking about infectious diseases, and has tons of experience with everything from SARS-1 to MERS, and she's fantastic. We're lucky to have her. And since the COVID-19 outbreak began, basically she's been working on research related to understanding the clinical features and epidemiology of COVID-19 and the safety and effectiveness of COVID-19 vaccines. Dr. McGear also sits on the Lung Health Foundation's National Lung Health Advisory. So without further ado, Dr. McGear, please take it away.
Thanks very much, Carly, and thank you for the opportunity to be here and to talk a little bit about the miracle that is COVID vaccines. You know, one of the hardest things now, I think, is that the vaccination road is so bumpy. You know, we don't know when the supply is coming. We're trying hard to get vaccine into the right people at the right time, but you can't do it perfectly. And even though people are doing their best, honestly, we're about a D+, I think, in the country about how we're getting vaccines out and communicating everything. You know, you really want to have a registry for the whole country and really clear instructions about what you can get when, and it's not working, right? Okay, but, you know, and then I pause and I think, wait, okay. 3 months ago, I didn't think we were going to be starting vaccinations until at least April or maybe May. And the fact that we have this, the fact that we're going to get millions of doses of vaccines into people by June, there's just no question it's a miracle, okay? But it's a slow, painful, confusing miracle. Okay, so it, you know, it's got two sides to it, and you are going to have to, for the next 3 months at least, all of us are going to have the patience of Job, okay, because it's just going to be slow and bumpy until we get there, and we're dealing with variants now, and so we're really worried that cases are going to climb quickly, especially in Ontario. So, you know, you can see the end coming, and it's brilliant, but it's going to take a bit to get there. So I want to talk about two specific questions that a lot of people have, that it's useful to know kind of where things are coming from and why you do or do not have to worry. And the first of them is this sense, totally reasonable sense, okay, that the vaccines have come way too fast, all right? The record for a previous vaccine, from, you know, the thought of it until it was licensed was 4 years. Now, that was like 40 years ago, okay, and we have learned a few things since then, but still, you know, normally vaccines take years and years and years to develop, and this just feels like it came out of nowhere, right? So it's helpful to understand that there's a reason for that. Okay, oh, well, there's more than one reason for it, okay? And the first of those reasons is that we knew this was coming, okay? We knew a pandemic was coming. We knew we were going to need rapid vaccine development. So the vaccine manufacturers, the regulators, the people who do the science of vaccines, the people who do clinical trials developing vaccines have all been working for the last 20 years on how we do this more quickly if we have to, okay? And so on January the 5th last year, all of those things kicked in. Okay, and everybody said, okay, this is what we agreed we're doing. Now let's look at it. Can we do something better? Can we do something faster? And we need to get moving. And then people worked literally 24/7. So some of the vaccine companies actually rented entire hotels next to their lab, and the people who worked there slept in shifts. Okay, there's just a lot of work that has to go into vaccine development. You've got to develop antigen assays. There's this long train of things that just take time. But of course, it takes less time if you're doing it 24/7 than if you're doing it 9 to 5, 5 days a week, which is what we usually do. Okay, and then we worked really hard at compressing everything. So the most dramatic example of this is, okay, what happened in December was we got the report of the phase 3 clinical trial from Pfizer, And 3 days later, we had vaccine. It's like, whoa, wait a minute, okay? Because normally what you do is you work through each of the processes till you get to the end of them, and then you look very carefully at the data and you say, okay, the phase 1 trial met our criteria, it looks good. Now we're gonna plan the phase 2 trial, because it's a waste of money to plan the next phase before you do it. And one of the big things we do is everything up until the end of the phase 3 trial is research, and then we go to commercial production. We make a plant, we create a plant, okay? We do commercial production, and then we have to do some more testing of commercial lots of the vaccine to make sure they're the same as the research lots of the vaccine. So what Operation Warp Speed in the United States did was they built the manufacturing plants for the research trial. It's a gobsmacking amount of money, okay? It's just like they spent all this money doing commercial production of vaccines when they had no idea they were going to work. Okay, and you know, you look at it and you think, well, how can somebody do that? But the answer, of course, is because it's going to save the world from COVID. Okay, you know, millions of people have died from COVID. The economic devastation is awful. That investment was worth every penny. Okay, in terms of payoff. But that's why. Well, and then one last thing, okay, which is kind of cool, okay. There are very few silver linings to the COVID pandemic, but one of them is it looks like it's not that hard to make vaccines that work, because almost all the vaccines that we've tested are working fine. So, you know, think of it. There's some things, HIV, malaria, group A strep, we haven't been able to make a vaccine that works for 30 years, okay. This thing, pretty much everything everybody tried is working well. So that combination is what got us vaccines so soon. But it's not coincidence, and it's not because we cut corners, and it's not because there's issues with how people made it or how people reviewed the data in order to approve it. It's just because people were working really hard at trying to get us out of the pandemic. The second interesting question that a lot of people are worried about before I stop is, am I going to get long-term side effects from the vaccine? And this is kind of a cool psychological thing about vaccines. You know, when somebody prescribes me ampicillin for a urinary tract infection, I don't say, I'm worried about getting long-term side effects from the ampicillin. I'm not worried about getting short-term side effects, okay? You can get in the short term, you can get side effects from any medication and any vaccine for sure. But vaccines are not different than medications. You know, they are given to you. They have an impact at the time. The impact of a vaccine is different than the impact of an antibiotic, but it's the same principle. They survive for a short period of time in your body, they do their job, and then they're gone. So we've never had a vaccine in which there are any long-term side effects. It's just that vaccines themselves, because we give them to well people, to prevent things in the future, are naturally scarier than medications that we take when we're sick and we want to get better. So it's completely natural to raise all this list of concerns, but it's really, you know, it's really very easy to reassure people that long-term adverse events with vaccines don't happen any more than they happen with medications. And I'm going to stop there and turn it back to Carly and Dr. Rutledge.
Thank you so much for that, and I can't wait to get into some of the more questions about this. But before we do that, I'd like to introduce Dr. Rob Rutledge, who is a radiation oncologist in Halifax, specializing in breast, prostate, and pediatric cancers. He is an associate professor in the Faculty of Medicine at Dalhousie University, the CEO and chair of the Healing and Cancer Foundation, a registered charity that offers free educational videos, documentaries, as well as live and webcast seminars. Dr. Rutledge has done so much in this realm and has a ton to say, I think, about COVID and its impact and the impact of vaccinations for the cancer patients who are out there and their families and caregivers. So without further ado, Dr. Rutledge, please take it away.
Thanks, Carly. It's a real honor to be joining the experts who are the COVID infectious disease experts. I joined a meeting on Monday night, a couple nights ago, of oncologists across the country, and we got a huge update in terms of the risks of COVID and the vaccines and what people should be doing and so on. And I came away very, very optimistic from that. First of all, the vaccines really reduce the chance of getting sick, no matter which type of vaccine that you get. That they're safe, and that there are ways to give it to people who have a cancer diagnosis. And even if you're immunocompromised, even if you're on chemotherapy, there's ways to work around this to get that vaccine in you. And I came away thinking, geez, soon as you're offered the vaccine, you really need to go out there and do it, because it's really going to help you no matter what type of condition, or your risk will really be reduced. So we put the vaccine into the population, and we continue to follow the guidelines, the self-isolation, the masking, et cetera, et cetera. We Canadians are going to do this. We're going to beat this back by doing vaccination and following the guidelines, and we as a community can really, really, really make a difference. So I'm excited. There's lots of kind of other things I'm excited about. The fact that the variants, Allison was talking about the amazing technology that we can actually, as a variant comes out, there are new technologies to match that and get a better vaccine if we need to, for instance. But I'm just feeling like if we do this as a community, as Canadians, we can really make a difference, and it can make a difference in the short term versus the long term. So anyways, I'm excited to answer this, and actually probably more like listening in to the two experts answer the question. So anyways, thank you. Thanks, Carly.
Thank you guys so much for that nice overview and intro, and now everyone's in the hot seat. So yeah, as we mentioned off the top, this is obviously a very sort of big day, I guess, for everyone, thinking back to where we were a year ago and how far we've come. And, it is a really good opportunity to reflect on where we're going with vaccines. So I'd like to just thank the Lung Health Foundation and the Canadian Cancer Survivors Network for hosting this discussion. So diving in, we've been hearing reports all day about the AstraZeneca vaccine being paused in parts of Europe. And we know that they're being given out, across parts of Canada now. There's a lot of people who have concerns about that. There's also general concerns about how these vaccines stack up. Should I be waiting for the Johnson & Johnson shot? Should I try and get that Pfizer shot? This idea that they're not all equal. So I'll throw this out first, maybe to Dr. McGear and Dr. Constantinescu, and maybe you guys can just tell me what you think. Perhaps first, I'll go to Dr. McGear to speak about the AstraZeneca news today, and then maybe a bit more generally about what we can say about how these vaccines work, on a head-to-head sort of basis.
Yeah, so the news today is part of this bumpy road about vaccines. We are always extraordinarily cautious about vaccines, and I know that you probably don't pay attention to this, okay, but I kind of live and die by vaccines, and at least every second year, there's at least one country that puts their influenza vaccination program on hold for a period of time because of some issue that has arisen. It's never turned into anything, okay, but it's what we do to be precautionary. It's harder in COVID because everybody's watching you, and because COVID is so serious that we really want to make vaccines move quickly. But it is critically important that we are very, very careful about the safety of vaccines. And the challenge with vaccinating millions of people every day, which is what we're doing, is that bad things happen to people, okay? It's just one of those things in life. So we're talking now about a small number of people, fingers of one hand by my count, in some countries in Northern Europe that have been diagnosed with serious blood clots in the period of time after they get vaccinated. And the key question is that something that was caused by the vaccine, or is that just something that happened at the same time? And if so, the US has a bunch of really good data on how often things have happened to adult populations. So I can tell you that in their vaccine safety data link population, okay, which has 12 million people in it, you would expect in a 3-week period, 428 people with blood clots, and 132 of those people would have pulmonary emboli. So those are blood clots that get into your lungs that can be really serious. So when you hear 4 or 5 people in Denmark and Austria post-vaccine, there's no way of knowing whether that's just what would have happened and we've seen it, or whether the vaccine is causing it. It's actually, it's a really unusual adverse event associated with vaccines. It's not something we would expect. My educated guess would be that we're going to put it on hold. We're going to do the investigation. We're going to figure out that it's not caused by the vaccine. Remember in Norway in December, they put their vaccines for nursing homes on hold because they had some people who died in nursing homes, and then they did the investigation and they said, nope, it's okay. Deaths weren't caused by COVID and they weren't higher than expected. And we went back to everything and everything was fine. So that's the phase we're in with this, okay? So the people who have the most data on this in Canada are our vaccine experts at the Public Health Agency of Canada and Public Health. They will be in contact with the company, with the regulators and the experts in Europe. They will make a decision about whether it's best for us to continue our AstraZeneca program or to put it on hold temporarily while we wait to see the results in Europe. It is a little bit reassuring that our vaccine is manufactured in a different plant. So there's some questions as to whether this might be a particular batch or the overall vaccine. We definitely don't have this batch in Canada. We don't have to worry about that. But obviously we are using the vaccine. So I think this is a circumstance where we need to trust our public health people to make the best decision for us about whether we should go forward or stop at the moment. And then we'll just have, this is part of the patience of Job piece that you have to have for the next 3 months. We just have to wait to see what the investigation shows and whether we have to worry about it. Hopefully, it'll turn out to be unassociated with the vaccine and we can go right back to vaccination programs. If that doesn't happen, we'll take a bit of a hit in how many vaccines we get, but remember we have Novavax and Johnson & Johnson coming up, so there'll still be lots of vaccines coming in the short term.
Thank you for that. And Dr. Constantinescu, maybe you could just briefly touch on that. We're just to know we're halfway through our allotted time, so we'll just try and motor through some of the rest of it.
I don't have much to add except to say this is how careful people are about safety and how cautious people are around safety around this vaccine. So this is exactly as Dr. McGear said. To me, also biologically, doesn't seem to be a lot of plausibility. We haven't seen that with a lot of other vaccines. And yet, this is why I think it's so important for people to remember that safety is taken so seriously around these vaccines that people are saying, okay, we know this is going to potentially affect lives. It's going to be expensive to stop things, but we're going to stop things to make sure that we're going forward safely. And you know, just to bring back to the idea that, as she mentioned before, there was no compromise on safety in the phase 3 trials, and there are no compromises now in the real world surveillance kind of type of data that we look for.
And I'll try to be quick on the subject of different vaccines. So it's all of them are good, okay? It's possible that one or more of them is a little better than one of the others, but we don't know that yet. So get a vaccine, okay? Any one of these vaccines has a huge impact. We're talking, you know, 80, 84, 90% reductions in the risk that you will be hospitalized or that you will die if you get an infection. So all of these vaccines are good. If it turns out that one of them is a little better than the other and it means that people should get it, by November, we're going to be swimming in vaccines. And the people who got the one that maybe wasn't as good will just get a dose of the one that's a little better. It'll be okay. So just get a vaccine now because they're all good, and wait for the data to know whether you might need a booster or something different later.
That's fantastic and very, very. Oh yeah, please. Sorry, go ahead.
Well, just to say to that, you know, the reason this virus has brought the world to a halt is because it causes so much death and hospitalization. And if we can stop that, and it has now shown that a dose of any of these vaccines does that so well, then we can lift the specter of death from our societies. And you know, speaking to people anecdotally, after they've had one dose of the vaccine, there is a lift of this constant fear that yourself and your loved ones are going to die of this virus. And if we can remove that, the fear of death and the fear of hospitalization, not only will it propel the economies forward, but think about the effect that has on mental health. Just the people I've had in my family, and I've had a few family members who've been vaccinated, it's just this huge relief to know that I no longer have to worry about them dying. So don't underestimate the power of one dose of reducing hospitalization and death. That's incredibly powerful on a population level, but also on your own personal life.
That is a fantastic point, and I think that's one of the things that often does get missed. I mean, and I think for people that still, there are still people out there that are saying, why did we even lock down? This is no more dangerous than the flu, and all of these sorts of dangerous myths. I mean, we really are looking at those end points of hospitalization and death in these huge, huge numbers, and the fact that we now have a way to maybe make this virus maybe not disappear, but certainly less lethal. I think that is just, yeah, as Dr. McGear said, it's a miracle. So I don't want to make Dr. Rutledge feel too left out, and of course, we have a lot of patients, families, I'm sure, and caregivers who are watching, and so I'm going to break the reporter's rules here, and I'm going to ask you a double-barreled question, which again, not great to do that because I want to make sure you answer both, but a simple question, perhaps, and then maybe a bit more of a broad question. So first, there's a question, I think, from the audience about if I'm otherwise healthy, but I've had chemotherapy, how long am I considered immune compromised? And then also, I was hoping that maybe you could reflect, I know you've been speaking to some colleagues, I think, this week, maybe you could reflect a little bit on what some of your colleagues are saying about, immune compromised and cancer patients with COVID vaccinations, what some of the research is saying about this population. So anything you can tell us about that?
I'll be quick and I'll hand it off to the experts here. First of all, even if you're immunocompromised, it seems that, or at least theoretically, it seems that it's actually going to reduce your risk of being very seriously ill or dying. So even if your immune system is not working great, you're still protecting yourself there. So what was the first question?
So if you are otherwise healthy, yes, how long would you be immune compromised?
Really, most people who have been through their treatment, their immune system comes back, they're really kind of running at near normal levels. And so therefore they would be able to mount the response that's very helpful in the vaccination process. Over to you, Allison, in terms of immune compromised.
Yeah, one of the things that's different and hard for people about this virus is that it really causes significantly different disease than any other virus we've known. And so, normally when we do flu vaccine or pneumococcal vaccine for adults, we're really focused on the dramatic increases in risk from these infections when people are immune compromised. That actually doesn't happen with COVID. Okay, and we don't completely understand why, okay, but we know it to be true, and that's why you're watching. We're doing an age-based vaccination program very substantially, and that is specifically because COVID is different. That the risk of hospitalization and death in COVID is dramatically associated with age. It is associated with some other specific populations. So people who are on kidney dialysis, maybe in part because they have to go back and forth to the hospital 3 times a week. People who have hematologic cancers, so people who have leukemias and lymphomas are at somewhat higher risk, but much less risk than they are relative to other people with other infections. But generally speaking, it really is age-based. So everybody who has had cancer or who's dealing with cancer now, which is, cancer and COVID at the same time is really hard, okay? It's just an enormous challenge. And everybody would like, if only for people's mental health, we'd really like to be getting COVID vaccines to everybody with cancer to make their lives better. But we kind of really like to be getting vaccines to everybody, okay? And we can't do that all at once. So there is this differential where people who have cancer or have survived cancer may feel a little bit like they're being ignored. And so I want to assure you that you're not being ignored. It's just that public health people are really focused on what the science tells us about risk. And that science is telling us that age is more important than anything else. So, you know, we're back to the patients thing. People are going to take into consideration underlying illness when we get there. People who have had cancer will be prioritized, but it's going to take longer than we would like.
Perhaps maybe expanding a bit on that, and this might be an opportunity, everyone might want to jump in on this one, but there has been a lot of debate about prioritization, and I think that beyond age, you know, we're sort of still in some provinces doing the first go around in trying to get the really vulnerable people, you know, vaccinated, maybe just the, you know, long-term care residents, for instance. Now that we seem to be moving on from that, there does appear to be a bit of a disconnect from policymakers about who exactly should go next. And I think for people who are sort of in the, you know, patients who have compromised immune systems, chronic illness, people who are sort of maybe have a number of health issues who might be listening right now, they're, I think, feeling maybe frustrated and confused, or at least some of them are. And maybe, I don't know if everyone wants to weigh in, or I would like you all to weigh in. And perhaps Dr. Rutledge, you could maybe just start us off and just offer any reflections or things that you sort of think maybe we could be doing a little bit better, or things that might be encouraging, just on this idea of who should we be prioritizing. You know, there's, you know, should we be placing more priority on cancer patients or people with compromised immune systems? I mean, how are we getting the balance right?
Well, I think Allison kind of listed it quite clearly. What are the risk factors for somebody to get a serious infection? In fact, you know, the age and those other chronic illnesses actually trump a previous cancer diagnosis. And secondly, these are like super smart people who are looking at all the data. Yes, it's inconsistent across the country, you know, to some degree, but every single province is trying to make the same decision. Who is most vulnerable? Who can get the vaccine to first? And then kind of slowly go down that list. And just, I didn't answer it as clearly. Yes, if you've had a cancer diagnosis and you've recovered from your treatment, really your immune function is pretty darn good. So you're really back to kind of population base in terms of, you know, your age and other medical problems. So those are the more important factors than just I've had a cancer diagnosis. So go ahead.
Yeah, one of the other really interesting challenges is one of the modelers did a presentation last week because, of course, your risk of getting serious illness from COVID is not just about you, it's about who you come into contact with, right? So their modeling actually suggested that we should be starting to prioritize essential workers, because when you vaccinate essential workers, then they don't transmit to those of us who are old. And you might actually get a better benefit per dose of vaccine administered if you protect people by preventing transmission to them. And that's, you know, so now everybody's looking at that saying, oh, that's really interesting. How sure are we about, you know, the data behind the model and how we're doing it? So there's still a lot of unknowns about exactly what the best way to do this is. And it's still really hard. You know, we want speed, we want efficiency, we want equity, we want to get it to the right people at the right time as fast as possible. And it turns out, no matter how good you are, well, okay, maybe Israel, okay? But pretty much no matter how good you are, you can't do all of those things at once. I think the only piece of good news, modified good news, okay, is that we're talking about gaps of 3 or 4 weeks between different groups. So it's hard, and yes, there are going to be unfairnesses. Okay, somebody pointed out to me yesterday, for instance, that if you're 75 in Alberta, you can get vaccinated now, but you have to be 90 in British Columbia and 80 in Ontario. And now in Ontario, we're vaccinating 60 to 64-year-olds, but if you're 69, you're like totally out of luck, even though you're at higher risk. But you know, these are short-term things, okay? And you need to try to hold into your head that we're not talking like a year before this will be fixed. We're talking about weeks.
That's a great point. Dr. Constantinescu.
Yeah, that's exactly what I wanted to mention. You know, it's hard, this sense of the wild swings in recommendations, the sense of inequity, the sense of inconsistent messaging. It's been so hard, and it adds to this frustration because at the end of it, we're all feeling unsafe, and because we're afraid that we're going to be left out and we're going to get COVID in the last stretch. And I see that, and I hear people feeling that way, to the point where people almost feel victims of public policy, as opposed to seeing the public policy is there to help them. And let's all take a big breath, because just like Dr. McGear said, it's just a difference of a few weeks. Truly, if you look at the Albertan, the different phases, it's a matter of 2 to 3 weeks between being, over the 65 and then under 65 with comorbidities, which everybody with a cancer diagnosis, diabetes and so on would qualify in. It's a matter of a few weeks. Let's focus on how best to book that appointment when your time comes, and how to talk to your friends and colleagues and everybody to take this vaccine, because when the numbers are low in the population, we're all safe. And we can put lots of mathematical models out, and I tell you, we've seen it. We've seen it. When the numbers went really high, schools had to be shut down, and nobody was safe anymore. If we can get it all down, focus on what you can do about yourself and how you book it, and focus on being vaccine champions to the people around you, because then you can change stuff. But otherwise, it's a matter of a few weeks.
Yeah, that's a great way of putting it. And I think, we're all sort of thinking we need to think maybe more of the long game. But and then there are concerns, of course, about, as we mentioned, variants and all of these other things. And anyway, there's just so much going on, it seems. I just wanted to mention quickly, we have some questions coming in. Please keep those questions coming, and we're going to get to as many as we can, including the next one. So we've already talked about what happens if you finished treatment. How long are you basically going to be immune compromised? What is the recommendation for people? And this would be for Dr. Rutledge, and whoever else wants to weigh in as well. But what would be the recommendations or the best practice right now for people who might still be undergoing treatment, and then there's a specific question about maybe someone who's had a lung transplant. So any guidance there?
Yeah, so it's very clear. As soon as you're offered it, please take it. Now you're going to have to work with your physician. So for instance, somebody who's in the midst of chemotherapy, the recommendation is to get the vaccine when your blood counts are at their highest. And that's usually 2 or 3 days prior to your next course of chemotherapy. And there's all sorts of variations on that. If you had high dose chemotherapy, you have to wait a couple months type thing. But really, if you can get it, please take it. And it doesn't matter which one you get, is the takeaway from the oncologist meeting on Monday night.
Okay.
And Carly, maybe just to align to people, it's not a safety issue, right? So this is important to remember. So when you're immunocompromised, the issue here is not safety. The only vaccines we recommend against when you're immunocompromised are live vaccines. These are not. So it's not a safety issue. The reason for the chemotherapy wait and so on is to try and optimize things like your response to the vaccine, how well you're going to be protected, the risk of bleeding at the site as you're getting it, and so on. But it's not a safety issue. We believe this vaccine is safe in the immunocompromised people.
Mm-hmm.
And if you get it, so studies are ongoing now with what happens in the immune response in people who have cancer. They couldn't be done originally, but they're being done now. So you get your first dose you get your vaccine now, and 2 or 3 months from now, we'll have data on how well vaccine works in people who've had transplants and people who are undergoing chemotherapy of a variety of different sorts. And then we'll know whether, for instance, you might want another dose of the vaccine once you've recovered and you're through your chemotherapy, or once it's safe to decrease your immunosuppressants. So it's not a lifetime commitment getting a dose of vaccine now. And it's pretty clear that even if the vaccines are not quite as good in preventing COVID in immunocompromised people, they're still a lot better than nothing. So,
yes,
get it now and then wait for the data to come, and then your oncologist or your other physician will talk to you at some later stage about whether you need another dose later.
Yeah, and that is, I think, a really good point to raise, all of them. But then this idea of safety, we're not talking about you being at risk if you get it. There's just some other issues to consider. So that's, again, a really important point, because I know a lot of people, there is a lot of concern. This vaccine has come very quickly, and there is a lot of worry out there about that. People just are simply, wanting to make sure that the best sort of data is out there. I think that there's I write a lot about people who are sort of, quote, vaccine hesitant, but I think when we talk about the COVID vaccine, there's maybe not some, maybe more legitimacy to when some people are questioning the safety, right? It's just, it happens so quickly. But that's why these sorts of discussions are really great, because you help unwrap and educate the people educate everybody about why it's not so risky after all. I wanted to speak. Oh, please, yeah, go ahead.
Just say, though, big picture, the death rates are actually dropping, right? So because the vaccinations have happened, fewer people are dying. So there's the proof in the pudding right there. So, and I just want to re-hit that point again. So it's vaccination plus keep on doing the self-isolation as you need to and taking care of yourself. If we all do that, that's the best protection. No virus is the best protection.
It's also, I think, when you're thinking about safety, normally when you start a vaccine program, you don't vaccinate all that many people, okay? And so it takes quite a long time to have enough people to be really sure that a vaccine's not associated with some rare serious side effect. But the Americans have vaccinated 30 million people in the last 6 weeks, okay? That's a huge number, okay? We've never detected either a vaccine or a drug, an antibiotic side effect that's required more than about 5 or 6 million people to identify. So we're well into the safety zone with both the mRNA vaccines and probably with the AstraZeneca vaccines. We haven't used much of it in North America, but there's lots of it being used in other countries. So the good news about how fast the vaccine rollout has been is gotten us a huge amount of data on vaccine safety very quickly. And these are actually remarkably safe vaccines.
Yeah, that's a great point to raise. I mean, I was just remarking earlier that every time you hear about some sort of adverse event or, something that may or may not be even linked to one of the vaccines, it seems like it's front page news, but we don't sort of hear, 10 million people vaccinated, no problems reported yet, right? So,
yeah.
So again, just, it's all about perspective.
It's a really hard thing to deal with, because of course we want people to be looking for potential vaccine adverse events. We want to be looking really hard for them. We care about them. We are happy to have people talk about them. On the other hand, most often when we identify them, they're completely unrelated to the vaccine at all. They're just, on any given day, if you're vaccinating 1 million Americans, 8 of them are going to have heart attacks, okay? Not because of the vaccine, but because 8 in 1 million people have heart attacks every day. And so separating that out is hard. And that means when you read about a serious thing happening to somebody who's had the vaccine, you have to stop and say, okay, this is what we have public health for, okay? Because they're in there figuring out whether it's from the vaccine or not from the vaccine. And I promise you, they care a lot about this. And they're making those decisions on an ongoing basis with lots of different surveillance systems to make sure that what we're doing is safe.
Fantastic. One of the issues that, again, surprisingly or unsurprisingly, probably thorny issue is the idea of spacing. Canada's kind of going its own way. And I know, this has been an ongoing discussion for a long time. There's people that say, look, we're now spacing out vaccines. We're being told it's safe to space them out by several months. Not a lot of places are doing that. Are there implications for, say, immune-compromised people? What are the implications? In the United States, they're getting advice that once you're vaccinated, you can get together because they're fully vaccinating people perhaps sooner than us. So maybe, I don't know if Dr. McGear wants to launch us in on this discussion or whoever wants to sort of take this one on, because I know there's going to be probably a lot to say, but just, spacing. Are we doing the right thing here?
Okay, so I'll give you my take. The spacing issue, as you say, is really highly controversial. And again, this is bumps in the road, okay? This is a pandemic. There's a lot of things we don't know. We're not always going to make the best decisions for absolutely everybody at the same time. But the challenge that public health people have had to face, in Canada in particular, is we're really short of vaccines. So we have a vaccine where if we give you one dose, we think it's about 70% effective in preventing serious illness and death. If we give you 2 doses, it's 85% effective in preventing serious illness and death. So imagine now I have 2 vaccines and I have 2 95-year-old parents. Do I give 1 dose each to both parents, thereby reducing their risk, each of their risks of deaths by 70%? Or do I give 2 doses to my father, who I really like, reducing his risk of death by 85%, and just let my mother take her chances, okay? And laid out like that, in the short term, it's very clear that the best protection for the population is 1 dose per person. The key problem question is, so then the next question is really easy to answer, which is, okay, if I get my dose later, will it not work as well? And the answer to that is absolutely not. It's actually better to have a longer space between doses. So you don't have to worry about not getting the bang for the second dose if it's spaced further apart. Absolutely not an issue. But you're allowed to worry a little bit about whether if you get 1 dose, your protection might decrease when you get out past 3 or 4 months, and then you might not be as well protected. And that's why we've set it at 4 months at the moment, because people are worried about it. It's also why we're looking really carefully. And the good news is that the UK, which also has this long delay in vaccination before the second dose, is about 6 weeks ahead of us. So if we get into trouble with waning immunity, they're going to know before we're in trouble, okay? It would be nice if we were further ahead in our vaccination program and the same as them, but this does have some advantage. So people are watching that very carefully, and one of the things that might happen 2 or 3 months from now is we might actually change and go back and say, oh yeah, okay, we figured out that immunity is waning. It might just be in older people or in immune-compromised people, you know, it's hard to tell. But there may be some people who we're going back to and giving a second dose to earlier than the 4 months. Or we might get out to 4 months and say, hey, look, the first dose is still really good, okay? So let's go for everybody before we give a second dose. It's one of the hardest things about pandemics is dealing with the uncertainty and the change every day, okay? And the only positive thought I can offer about that is when somebody says they're changing something and you think, oh, can they just make up their mind once? If we're not changing our mind during a pandemic, we're not learning. And if we're not learning, we're not doing the best we can do. So change, every time a public health person changes what they're saying to you, you need to take a deep breath and do a little celebration. Oh, look, they've learned something new. We're making it better. It's really hard to do, but it's worth trying.
Please go ahead.
Can I say that this is my, I think this being able to stretch the doses is probably the best thing that has happened to our slow vaccine rollout. Because there's one advantage of us being behind others, we can look ahead and see what's happening in other places. So that's the one thing. And then just to add to this, so now we know that 1 dose seems to be pretty good. We didn't know that 2-3 months ago. Now we know that it seems to be pretty good. We now know that we can stretch doses, and if anything, that kind of seems to improve the effectiveness of it all. But again, it's all about getting the numbers down. Do you guys remember when we used to have less than 10 people infected with COVID and we were all like, oh my gosh, 8 people, 8 cases. I will cry when we now have less than 10, because if we can drive down the numbers, then everybody's safe. And if we can actually decrease that by immunizing more, it will change your personal risk as well, because there's just less COVID out there.
Yeah, that's a really fantastic point to make, and certainly, yeah, I can't wait to get to that day as well. And I think, yeah, the thing that keeps coming up sort of again and again, I think, is a little bit of perspective, you know. And while you know, we seem to keep looking to the States, well, they're ahead of us, and oh, they're not spacing the same way we are. I mean, there is a reason behind a lot of this, and you know, we do have some really great experts here who are helping to drive some of this policy change. One of the questions that's come up, and I think I know why, because this was a story in Ontario, is that, you know, there are people there's concerns perhaps that people are going to be jumping the line, that there's not going to be, you don't need to show proof that you have a compromised immune system or a chronic illness, and then you can get your vaccination. So I think this comes back to this idea that there's a lot of people out there who feel as though, you know, they are at higher risk, and yet they're not necessarily at the front of the line, or they're not being given the priority that they want to see, and they're worried. So, you know, do we need to be making some tweaks in these policies, or do we come back to this idea, you know, this is temporary, you know, we'll get through this? I mean, what would you say about that? Because I think that particular thing in Ontario has angered a lot of people, that, you know, sort of anyone can go in and get a vaccine pretty soon. You don't have to show proof that you're actually, you know, quote, a priority group. Dr. McGear, you're shaking. Yeah, go ahead.
Yeah, I think, you know, it's really hard, because we are dependent on the majority of people behaving as if we're all in this together, and trying, each one of us trying to be fair and reasonable. And I think, you know, it's a really good news story when people aren't, but I think it's been a small number of people so far, and you know, I totally agree about Ontario. I really think we could have done better with the vaccine rollout in Ontario in terms of both speed and equity, honestly. But on the other hand, you know, as Dr. Contaminascu said, it's really only a matter of weeks in this gap. And some of the inequities, like what's happening with the AstraZeneca vaccine and the age gap, are just a consequence of kind of the best we can do, as opposed to anything deliberate. So yeah, I completely agree. I really do not think we're doing nearly as well as we could have done in the vaccine rollout in Ontario. At the same time, it's not that people aren't doing their best, and it's not that we're not going to get through this in a matter of a few weeks. So it's perfectly fair to be angry and upset about how badly we're doing with the vaccine rollout. It's perfectly fair when we get to the postmortem to be angry and upset about it. But at the same time, it is getting out there. We are giving out doses of vaccine. It's not totally unreasonable. People have all sorts of ideas about how to do it better and more efficiently. And the truth is, one of the things is that, you know, if you have to get a statement from your doctor about having an underlying illness, that really slows the process down, right? Because then you have to get to your doctor, and your doctor has to do something. And we're trying to get doctors to run vaccination clinics, okay? Not to be doing other things. So some of these decisions are made because, on balance, people are going to behave well, and because we really want this to work quickly and efficiently.
Anyone else want to jump in there before we move on? Okay. We just have a minute or two left, so I wanted to ask perhaps each of you. We'll start with Dr. Rutledge. One of the things that people are continuing to ask is what happens, after we're vaccinated. First off, how long before things start to open up? And I'm not sure how much you want to talk about that part of it, and maybe the others do. Sort of quote, what's herd immunity, that kind of thing. But what will life start to maybe look like? Is there any sense of, for people with compromised immune systems, people who have cancer, who have had cancer, I mean, are there any, as more of us start to get vaccinated, can they sort of, and they get vaccinated as well? How long until they, we sort of get back to that place of normalcy? So if maybe each of you can take a few minutes or a minute perhaps to talk about that, and then I think we'll wrap things up from there.
Yeah, so we're going to rely on the experts, and we're going to rely on the data, and it's $1 million question as to when the infection rates are going to drop, but they are going to drop, and life is going to get a whole bunch better. And I'm just happen to be an optimist that this is going to happen sooner than later, but we're going to follow the public policy, because if we're in this together and we can all get vaccinated, and if we can all follow the guidelines, it's going to happen faster. So I totally agree with Cora. We need to encourage our loved ones and our friends and family, because they could be giving the virus to us. They need vaccination and they need to follow the guidelines. If we do this together, we'll get through this faster.
Great, thank you. Dr. McGear.
So what I'm worried about at the moment is what's happening with variants, because we're just there's a lot of uncertainty about just how much trouble we're going to be in the next month with variants. I think you can already see cases in Ontario climbing faster than other places, and we have more variants in Ontario than other places. So that's kind of what you expect. So to me, I'm just praying that we'll be okay till the end of March and that we won't have to go into more significant lockdown, which we might because of the variants. But then, you know, as we get more people vaccinated, as we move into the better weather and people can get outside, I think things will start to settle down. I don't, however, think there's going to be a clean thing where we can say this is over. I think there's going to be a gradual progression as more people get vaccinated and cases go down, and then we'll kind of, you know, we'll do what we've been doing, right? Which is we release restrictions, and then if cases start to climb, then we have to go back on some of them. And so I think there's going to be this ongoing backing and forthing for much longer than you would like, but not forever. Okay.
Do you have a date?
I'm hoping. Well, I'm holding out for the end of this year. Okay. As when many of the restrictions will be released. But you know, it's one of the problems is it's going to get better slowly every day, and then one day you're going to look at somebody you love and say, well, look at that, I think we might call this over. But it's going to be you know, it's going to be a long, slow climb out, I think.
Thank you. Dr. Constantinescu.
Yeah, hold your horses, it will come. Don't trip just at the finish line. My gosh, variants are also keeping me up at night. I also worry. I think it's the public health, you know, people listen to public health, good testing, and that's what saved us from this being, from overwhelming us already, but we're not out of it yet. I tell you though, it's gonna be an end. But I think what was the problem from the very beginning is that people somehow thought that it was gonna end in 3 months, and they said, well, let's just wait and see what happens in another 3 months. And I think just set yourself a really nice long time. So just imagine that maybe by this time next year, we shall all be back to doing the regular things we were doing. And then if anything is sooner, then it'll be like a really nice surprise and a nice way to go back. I have to say though that I hope the two things that still stay are the people keep on washing their hands, because it has been awfully nice not to have influenza. And that people, this idea of presenteeism, so people not showing up when they're sick to infect, you know, their patients, their colleagues, their teachers, their students. I hope those things stay with us, because I've kind of enjoyed, other than COVID, I've kind of enjoyed the virus-free life that we've had over the last year. That's the one good thing that's come out of this whole thing.
Yeah, that's a fantastic note to leave things on. And I'll also add that I hope that all of our policymakers never, ever take for granted again that another pandemic will be coming, and get ourselves prepared and ready for that. So let's never be caught unprepared again. So I'd like to thank everyone for joining us. This has been so educational and informative and entertaining as well. You guys are fantastic. And just thanks to the Lung Health Foundation and the Canadian Cancer Survivor Network for hosting this fantastic afternoon. So with that, I'll say goodbye to everyone. Thank you for joining us, and hopefully we can all meet again sometime soon in person.
Take care.
Take care. Bye-bye.
Early.